Hello, Tom.
Hi.
Can I see your hand?
Mm-hmm.
Okay. So today we are going to just be going over a few different acupuncture points on the hand. These are known as master tongue points. The hand is another one of what we call the many microsystems of the body. So just like the ear is sort of a representation of the whole body, so is the hand. So there's a lot of really potent points in the hand that I like to use for my patients for a variety of conditions. And today we are going to look into the points on the palm and the dorsum of the hand in zone 2 of the master tongue points. Master tongue is one of the many greats of Chinese medicine. He developed a series of acupoints, distal acupoints, that are highly effective in treating a variety of conditions. I use them in my practice every single day. And the ones that we're going to go over, I don't necessarily use every single day, so these are going to be teaching you as well as sometimes teaching me as far as what these particular points do. And just a fair warning, I'm going to be mispronouncing all of them, so apologies if there are any native speakers here. I will do my best to not absolutely butcher each word. And we're going to start with the points on the palm of the hand. And so what we're going to do first is we're going to feel around and show you some of the points on the palmar surface of the hand. So the first point that we're going to locate is 2201, which is Zhongzi, or double child. And this point is on the thenar eminence, about 1 cun proximal to the margin of the skin fold between the first and second metacarpal bones. So this one is right there. Is that tender?
Mm-hmm.
Okay. So this point is for scapular and back pain, knee pain, shoulder and neck pain, muscle cramps, pneumonia, influenza, common cold, asthma, chronic obstructive pulmonary disease or COPD, cough, and the reaction area is the lung. So for the purpose of just sort of showing you the points, we are going to place some ear seeds on these points just as placeholders. So this one is 2201, right on this point. And then we have 2202, which is right at the junction of the first and second metacarpal bones. Let's see what the book says. So 2202 is Chongjian, or double immortal, and this is on the thenar eminence at the junction of the first and second metacarpal bones on the lung channel. So this one is right in here. Tender? Mm-hmm. Okay. Here. So right in this area here.
It's tender when you do that.
Not as tender when
you do your thumb though.
Oh, okay, yeah. Well, I'm mean. Okay, so 2202, 2201, Chongzi and Chongjian, double child, double immortal. So let's read about what Chongjian does. This one is for back pain, pneumonia, fever, palpitations, knee pain, especially the medial side. So these two tend to be very tender when palpated. If you have any one of these conditions going on, these correlate to the lung. And so Tom's lungs are always, constitutionally a little bit deficient. So these ones are a little bit tender on him because of that, most likely. You're not dealing with any back pain, right?
A little bit.
A little bit?
Yeah.
Okay. Yeah. All right. And then, so the next one is 2203. And this one is on the dorsal surface. So we're going to flip your hand over. So 2203 is All right. On the dorsum of the hand, between the second and third metacarpal bones, 0.5 Tsun proximal to the metacarpophalangeal joints between pericardium and large intestine channels. Right. So this one is sort of right, just half a Tsun proximal to the joints here in between the first and second fingers. And so, or the second and third rather. And so right around there, is that tender?
Mm-hmm.
A little bit? Okay. All right, so this one is Shang Bai, or upper white. And this one, so 2203, upper white. And like I said, these are just placeholders. We're going to show you some needling techniques later on, but for now, we're just going to use the seeds as placeholders. So the Shangbai upper white is for conjunctivitis, red itchy eyes, sciatica, lateral side chest pain or heart pain, shoulder pain, neck pain. And so this one is sort of the same point as another point in the classical point location texts called Lojian, which is also called stiff neck. And so this one is a really great point if you are dealing with a stiff neck. Rule of thumb, I would say, is always choose a point on the opposite side of where your pain is. So if your neck is really stiff on the left side, use some pressure on the right hand and vice versa. All right, so the next point we're going to do is 2204. So 2204 is on the dorsum of the hand in a depression 1 Tsun distal to the junction of the first and second metacarpal bones on the large intestine channel, distal to Hegu or large intestine 4, or overlapping with Li3, large intestine 3. So this one is pretty much right where large intestine 3 is, which is right around here. So 2204, Dabai, or big white. This is for childhood asthma, high fever, which is very effective for high fever, and sciatica due to hypofunction of the lung. All right, so 2204, Dabai, 2203, Shangbai, and we have 2201, Changzi, 2202, Chongjian. All right, and then we have one more on this page, which is 2205, which is right. Okay, so this one is my favorite point. This one is one that I use almost every day in clinic, and this one is called Lingu. So it's basically the mirror point to Chongjian, and it's right at the junction of these two bones. So the thumb bone and the pointer finger bone. And so right down here, Lingu, if you take anything away from this, if you're dealing with back pain, take Lingu away. Lingu is called miraculous bone. It is on the dorsum of the hand at the junction of the first and second metacarpal bones on the large intestine channel opposite to and communicating with Chongjian, 2202 on the palmar surface. So this one is for migraine, low back pain, sciatica, facial paralysis, hemiplegia, tinnitus, menstrual disorders, whether it's irregular, scanty, profuse, absent, polyuria, incontinence, foot pain, intestinal pain, difficult labor. So this one I love for low back pain, but if I have a patient coming in for, let's say, a induction treatment for, they're at term with their pregnancy, I like to use this to sort of move things along. So when I started today's lesson, we talked about how the hand is a microcosm of the whole body. And so the way that I look at it is that this is sort of like the back of the body. So this would be the head, this would be the arms, these would be the legs. So then this is upper back and shoulders here, and then down here is your lower back. And similarly on the anterior side or the palmar side, we have the face, the nose, the, neck and then into the shoulders here, the arms, the legs, the lungs here, the stomach and abdomen here, the lower intestine, large intestine, small intestine, and then the sex organs down here. So it's all a mirror. We are a big walking Fibonacci sequence, and it's really cool to see these medicines just have so many cool little mini systems within it. So, all right, so we're going to turn the page. All right, so for the next set of points, we're going to use the opposite hand, and we're going to go ahead and use the Sujicim needles. Now, these needles are super teeny tiny little hand needles. They are meant for hand acupuncture, and they come in these little packs of 10. And so these are them. And when you open them, you just want to make sure that you don't touch with your bare hands the needle aspect of them. And then we have a Sujicim sort of injector tool that you just insert one needle at a time and then just quickly boop, pop it in. But before we do that, I'm just going to put on some gloves, and we're going to wash off Tom's hand with a little bit of alcohol. Just keep it as clean as possible. All right, and we're going to use some alcohol just to cleanse everything and make sure that we stay safe. Okay, you can rest your hand that way. All right. So as you can see, these are super teeny tiny little guys. And when we use them, we can use them either free-handedly or we can use them with this little injector. I think the injector is a little less tender, a little less painful. And so we just insert one at a time. And when we insert it, we can't shake it out again. It stays in there. And so first we're going to locate that first point. We are going to start at the bottom of the page here because the palmar points are there. So we are going to do 22.11, which is Tu Shui, or earth water. This is a 3-point group, which is evenly distributed on the thenar surface of the first metacarpus, on the junction of the red and white skin, on the lung channel. The central point overlaps with Yuji, or lung 10. And so it's basically these sort of 3 points, the center point of which is in the middle of this sort of bulging part of the thumb joint. And then, so what I'm going to do is I'm going to first needle lung 10, which is sort of right in through here. And is that tender? Mm-hmm. Okay, so nice deep breath in and release. All right, so lung 10 is the middle aspect. It's this middle point in 2211. And then basically the next 2 points are evenly distributed between the joints on each side and the center. So we are going to so basically taking the halfway point between lung 10, which we just did, and the knuckle here. So right in through here, nice deep breath in and release. How was that? Not bad? All right, and the final point of 2211 is sort of another halfway. We always kind of want to make sure we're avoiding the veins. It's not a huge deal if you hit them, but we want to avoid if we can. So nice deep breath in and release. Okay. All right. So the actions of 2211 are for gastritis, gastric ulcer, pain in the fingers, and the reaction areas are the kidney and spleen. So that's 2211. And then 2210 is shoge, or hand release. It's on the palm between the 4th and 5th metacarpals, half a sun proximal to the distal transverse crease on the heart channel. Overlaps with xiaohu. This is for iatrogenic effects of acupuncture treatment, severe trauma, intense pain. And so this one, all right, so between the 4th and 5th, which is the pinky and the ring finger, so it's basically right where heart 8 is. And heart 8 is found by sort of putting the pinky down onto the palm, and wherever the tip of the pinky lands, that's where heart 8 is. So because I had him touch himself, we're going to just swab that real quick. All right, and so heart 8. All right, so this one, it doesn't say it in this book, but heart 8 in general is very good for headache. So if you have a headache specifically, like in the occipital region or the back of the neck, that kind of wraps around the ear and into the eyes, this point is a really good acupressure point. So just sort of land where your pinky finger lands, that is heart 8, and just sort of press on that. Another action for this point is that it sort of takes heat out of the bladder. So when I was in acupuncture school, I had urinary tract infection, and sitting in class, it was like almost unbearable with the burning pain that I felt in my abdomen. And so I would needle heart 8, and it would take the edge off pretty instantaneously. So if you're dealing with a UTI, obviously go get antibiotics, but in the meantime, while it's burny, you can use heart 8 or 2210, which is also known as shoge, to sort of take that edge off. All right. So then 2209 is sort of right in this ulnar edge of the palm here. So 1.5 sun distal to the wrist joint crease, 1 sun proximal to Wan Shu Yi, which is 2208 on the small intestine channel. Okay, so 1.5 sun, so that's right around here. Is it tender?
Mm-hmm.
A little bit? Okay. All right, so we'll get a point in there. And just in case, I'm going to swab that real quick. All right. So, nice deep breath and release. All right. So that's 2209, which is also seen right here, sort of right at that ulnar side of the hand. And 2208 is just proximal to that. So on the ulnar margin of the hand, on the junction of the red and white skin, 2.5 sun distal to the wrist joint crease, 0.5 sun proximal to SI3 on the small intestine channel. And then I'll tell you the actions of both of these points when I'm done with this one. All right. So 0.5, nice deep breath in and release. Okay. All right, so 2208 is Wan Shu Ni, or wrist flow 1. And this one is for headache, back pain, especially due to kidney vacuity, fatigue, nephritis, pain and fatigue of the whole body, sciatica, edema of the limbs, epistaxis, which is nosebleed. And so, and then 2209, which is the one we did before that, is for the same things, but also hip pain. So when somebody comes in for hip pain, I like to do this one almost every time. The whole side of the hand here is a really great spot to do acupressure for sciatica. So if you're dealing with sciatica, choose the opposite hand of whichever leg it's going down and just sort of palpate around that ulnar side of the hand for a little bit of relief. All right. So then we have 2207. These are on the dorsal surface, so I'm going to grab my sharps container, pull these, and then we're going to swab the dorsal aspect of his hand. Okay, so we're just going to pull these. All right, good job, Tom. And then we are going to do the final 2 points of this series on the dorsum of the hand. So we're going to take a new alcohol prep pad and just kind of swab all over. Okay. So the final 2 points of this particular series in Zone 2 are 2207, or Xia Bai, also known as lower white. This is on the dorsal surface of the hand between the 4th and 5th metacarpal bones, 1.5 tsuen proximal to the metacarpophalangeal joint on the Sanjiao channel, 1 tsuen posterior to Zhong Bai, or 2206. Overlaps the extra point, Yao Tong Shui. So 2207 is right here in between the 4th and 5th metacarpal bones. And this one we are going to use a Suji Chim needle for. And this one I use for back pain almost every single day. It's kind of sandwiched right in between the bones here, so it can be a little tender on people. But we're going to go ahead and pop that in. And the Yao Tong Shui that they speak of is a set of 2 points that is sort of in between the second and third metacarpal joints and the 4th and 5th. And so if we were going to do the matching Yao Tong Shui point, we would do that one. All right. There. So I always like to see this as a mirror image of the lower back. So again, the lower back sort of spans across this general vicinity. If the back pain is on the left side, I like to use 2207 or Xia Bai. And then if it's on the right side, I like to use the Yao Tong Shui pair, or both of these. And then the last point that is on the dorsum here in this point set is Zhong Bai, or center white. This is on the dorsal surface of the hand between the metacarpal bones of the little and ring fingers, 0.5 tsuen proximal to the metacarpophalangeal joints on the Sanjiao channel. It overlaps with Sanjiao 3. So this one is a little bit forward. All right, so 2206 or Zhong Bai. This one is for low back pain, fatigue, tinnitus, dizziness, hypertension, headache, sciatica, blurry vision, bone swelling, pain of the lateral malleolus, edema of the limbs. So that one is 2206, which is right here on the photo. and right here on Tom. Good?
Mm-hmm.
Okay. All right, so that's it for that series, and we're going to go on to the next page. Okay. All right, so let's take your right hand, and now we're going to do some points on the palmar surface. Interestingly, these points are not numbered, they're just named. So again, apologies if I butcher the names. So the next point we're going to do is Mugwan, or wood gate. This is at the base of the palm of the hand, about a half a sun distal to the prominence of the pisiform bone between the pericardium and heart channels. So this one is Mugwan, which is found right here on the pinky side. And we're going to take a little acupressure tool here. Is that tender there?
Mm-hmm.
Okay. So Mugwan right there. Tender there?
Mm-hmm.
Okay. So it's right around here.
Mm-hmm.
There we go. Okay. So that point, Mugwan, is for rheumatoid arthritis, swelling of the joints, bone swelling, and heel pain. I pretty much use the heel of the hand exclusively for people who come in with plantar fasciitis and heel pain. The heel of the hand mirrors the heel of the foot. So if you have pain in your heels today, one thing you can do at home is take the heels of your hands and sort of just clap them together, and you can do it pretty hard, and you can sort of like go all around and clap all the sides of your heels of the hand together. And as you do it, you can even press on your heel and see if it takes the edge off the heel pain in that moment. And if you have chronic heel pain, I would recommend doing that multiple times a day. You can't really overdo it, and watch your heel pain fade, I promise. Okay, so then we are going to we looked at Mugwan, which is sort of right in there. And then Gugwan, also known as bone gate, is on the mirrored side, sort of on the, at the base of the palm of the hand in the depression, about 5.5 sun distal to the prominence of the scaphoid bone between the pericardium and lung channels. And so that one is right around, Mugwan, Gugwan. Okay. Right there. That tender?
Mm-hmm.
Okay. So right there for Gugwan, right there for Mugwan.
Mm-hmm.
Okay. So then we are going to take some more alcohol. We're going to swab the whole hand just to sort of cover our bases. I'll just get my fingers. Okay. And so then we are going to take some more Sujicim needles. And we're going to go ahead and needle Mugwan and Gugwan. All right. So Gugwan was on the radial side, so the thumb side, and right about here. Okay.
Mm-hmm.
And then Mugwan is on the ulnar side, right about there. Nice deep breath in and release.
Wow. Shot right through the finger.
Oh, nice. Got some chi.
Mm-hmm.
Okay. All right. So good job, Tom. Okay, so the actions of these 2 points are for rheumatoid arthritis, swelling of the joints, bone swelling, heel pain. Okay, so the next point we're going to do is Fan Ho Shui. This is on the dorsum of the hand, so we're actually going to pull these out. Gu Guan, Mu Guan. Ooh, got a little bit of blood here. All right, so we'll have you flip. So next we have Fan Ho Shui. This is on the dorsum of the hand, One Sun distal to Ling Gu. So let's see, Fan Ho Shui. All right, so Fan Ho Shui is on the dorsum of the hand, One Sun distal to Ling Gu, which is right here. This is 2205, which we did earlier, at the ulnar margin of the first metacarpal bone between the lung and large intestine channels. So if Ling Gu is right here, we're just going to needle Ling Gu once again. So Ling Gu right at the junction here. Nice deep breath in and out. Okay. And then Fan Ho Shui is One Sun distal. So One Sun is about the width of the thumb. So if we take our thumb from that point and sort of go along the thumb joint itself, so actually this way. So it is about right here. So nice deep breath in and out. All right. So Fan Ho Shui is for back pain, shoulder pain, and that is it. So back pain, shoulder pain, and then Ji Han, or stop sweating. Oh, you need that one. Is on the dorsum of the hand between the third and fourth metacarpal bones, 1.5 Sun proximal to the MCP joints between pericardium and Sanjiao channels. This is a special point from Dr. Hu Bing Guan. Let's see, so Jihan is, all right, so this is between the third and fourth metacarpal bones. So this one is right around here, is it tender? Mm-hmm. Okay. We're going to swab that once again real quick. And all right. So this one is Jihan. Being careful to avoid any veins. All right, and so Jihan, stop sweating. This stops sweating in various diseases, and we'll see if it does the trick. Oh,
Try.
You're no longer sweating. All right, so the next point we're actually going to skip. This one is to promote growth in delayed development in childhood. Because Tom is fully developed, we are going to skip that one, pull these, and see what's next, if anything. Okay, so the final points that we're going to do today are on the dorsum of the hand, which is the top of the hand. And these ones, about half of them I use quite often. And so we are going to, let's take your left hand. I'll have you put it over here this time. And we're just going to swab it one more time. And this time we're going to use our serins, which are these little tiny, tiny green needles. Green needle. All right, so the first point here is Dabai. So Dabai is one that we've already done. This is just an alternate location. This is the same point location as Hegu or Li4, which if you take the hand and you sort of put your thumb to your forefinger, or your pointer finger, it's at the prominence of the bulge that happens here, sort of like right at the edge of the skin fold here, just above at the tippy top of this mountain that is formed by the muscle here. So you can go ahead and relax. And so this one, Dabai, alternate location, which is basically Li4, which is right here. This point is the command point of the face. It helps to drain the sinuses, it helps with back pain in the thoracic region, it helps with pain all throughout the body, and it is especially good for migraines. So I use this one every single day in my clinic on almost every patient. Next we have Zhong Kui. So Zhong Kui is on the dorsum of the hand, one soon distal to Dabai. So Dabai is like right here. So then we have Zhong Kui, right? Sort of right by the joint here. So nice deep breath in for me and release. Okay, so this one is for common cold, high fever. And I would say it's also a good one for sinus congestion. It's like right next to LA3 there. So, and then we have Sancha Yi, Sancha Air, and Sancha San. So these are a group of 3 points that I use a lot for back pain. And this one, oftentimes I'll use a very long needle and I'll put it right in each joint here and thread it sort of all the way back. We're not going to do that today. We're going to swab these again. We have Sancha Yi. So Sancha Yi is on the dorsum of the hand between the joints of the second and third finger, between the large intestine and the pericardium channels. So sort of right in through here. Nice deep breath in for me and release. All right. And then you sort of guide her in. And so Sancha Yi is 3 openings 1. This is for shoulder pain, backache, neck pain, lower back pain, hypochondriac pain, stomach ache, irregular menstruation, and metrorrhagia. Also, it regulates and strengthens the lung qi. So that's the first of this set of 3, Sancha Yi. Sancha Air is the next one. This is on the dorsum of the hand between the MCP joints of the third and fourth finger, between the pericardium and Sanjiao channels. So basically right here. Now he's got some pretty bulging veins here, so we are going to do our best to avoid those. Whenever there's a vein, I like to sort of just kind of like, even if the point is right on it, I like to kind of do it right next to it and then aim it so that it's still on the point but not in the vein, which is always appreciated by the patient. And then the final point of this series is Sancha San, or 3 openings 3. First, Sancha Air is for knee joint pain, acute lumbar sprain, diseases of the 5 sense organs, and it also strengthens the heart. So then Sancha San, or 3 openings 3, is on the dorsum of the hand between the joints of the 4th and 5th finger on the Sanjiao channel, identical with SJ2 but needled deeply, advanced towards SJ3, which is Zhongbai, which we did earlier, or Shaohu, or Heart 8, along and parallel to the metacarpal bones, with the hand forming a soft fist. So that one is right there. And Sancha San is for common cold, headache, shoulder pain, diseases of the 5 sense organs, sore throat, tinnitus, palpitation, redness, swelling and pain of the eyes, urticaria, leg pain, droop or heaviness of the eyelids, fatigue, myasthenia gravis, and it also strengthens the spleen and kidney. So these three are great. I mostly use them for pain. So whether it's neck pain, shoulder pain, back pain, they are amazing points for pain pretty much anywhere on the trunk of the body. So we are going to kind of stop there. What I'm going to do is I'm going to pull these, and then we're going to send Tom home with a few semi-permanent hand needles. These are little teeny tiny plasters that you can keep on your hand for probably the rest of the evening, and I would pull them off if they bother you. First, I'm just going to swab them one more time. Okay, so we are going to put down a few points here. Okay, so I don't know if you can see it at all. But there's a teeny tiny little needle. So these are little semi-permanent, well, not semi-permanent, but little temporary needles that can go in. So we're going to do Li4 or Hegu. That one is for like asthma, allergies, lung distension, sinus pressure. If you've ever seen any of Tom's videos, you know that that's his jam. And so we're going to do that one. We're going to do 2206 or Li3. This one is for sinus pressure as well. Okay. All right. And then we are going to do Lingu. And so Lingu is right here. Okay, so you are all set. You can keep these on for like, I would say until you go to bed. Pull them off before you go to bed. Put them in a sharps container, and we will see you next time.
Good, thank you.
You're welcome. Do those hurt at all?
No.